Good evening, ladies and gentlemen. Thank you again for being with us. This evening we're reporting to you that we have identified an additional 370 new cases of COVID-19. We're reporting also that there have been an additional 16 deaths, which brings our total number of deaths since the beginning of our experience with this pandemic to 174. And I'd like, as ever, to express our condolences to the friends and to the families of each and every one of those people. The additional 16 deaths comprise 6 females and 10 males. 11 of the 16 are in the east of the country and 5 in the west of the country. And so far, 4 have been identified to us as having an underlying health condition. Just to give a little more information in relation to the 174 deaths that we've seen so far, 132 of those have occurred in a hospital environment. That's 76%. 20 of them in an ICU. That's 12%, and 127 have been reported as having an underlying health condition. That's 73%, and the median age of all 174 deaths is 81. A more detailed breakdown of the cases up to midnight on Saturday last, the 4th of April, involved 4,916 cases. 1,265, or 26%, had been hospitalised. 169, or 3.4%, have been admitted to intensive care. There were 260 clusters identified involving 989 cases. 1,263 are reported cases among healthcare workers. That's 26% of the total. And the median age of all of those cases is 49. You'll be aware that some additional testing was commissioned from Germany for some older tests that had been taken, and of 6,129 samples received back thus far, 468 of those are positive, or a positivity rate of 7.6% of those. And those numbers will be fed into our modelling team over the course of the week, and we will have more up-to-date figures in relation to modelling either on Wednesday or Thursday evening with Professor Philip Nolan, as we've done before. In terms of intensive care units, the breakdown of 175 admissions to intensive care show that 33 people had been discharged from intensive care. An additional 20 people have died, sadly, in intensive care unit environments. 131 of that 175 are reported to have an underlying health condition, and the median age of those intensive care admissions is 61. A more detailed breakdown then of our healthcare workers. 68% of them are female, 32% of them are male. 33%, or 417, are nurses. 28%, or 365, are other healthcare professionals. 213, or 17%, are doctors. 147, or 11%, are healthcare assistants, and 19, or 1.5%, are porters. And in terms of the breakdown of transmission among those healthcare workers, 337 are nosocomial or spread or infection in a healthcare setting. That's 26% of the healthcare workers. Community transmission accounts for 846, or 66% of them, and travel accounts for 101 cases, or 8%. Also reporting that we have 99 clusters now associated with infection in nursing homes and residential settings, 65 of which are in the east of the country. And the overall breakdown in terms of transmission status is that 2 out of every 3 cases, 65%, are reported as community acquired, 12% associated with travel, and 23% contact with confirmed cases. So that's the summary update, and we're happy to take any questions you might have.
Dr. Hoolan, good evening to you. Can I ask about the upcoming weekend that's on the way? It's a bank holiday weekend, it's an Easter weekend. The weather is certainly improving out there, and the forecast looks like it's going to be a lot better. We hear reports of people travelling, for example, to second homes around the country, planning for that, or currently doing that at the moment. And the Gardaí don't have the enforcement powers yet to enforce what the new powers that were given under legislation. What concerns would you have about this weekend? Could that see a setback in the effort to reduce the spread of this virus, and what can be done about it?
For the foreseeable period, we want people to adhere to the public health advice that we've issued. That includes, in terms of travel, staying, other than for essential reasons, and we've set out what those are, either essential work and travel to essential work, or assisting with vulnerable people and so on. We want people to stay within a 2-kilometre radius of their home and to not engage in any unnecessary travel and to stay at home. That's the message. That will be the message as far as we can see at this moment in time. We meet again tomorrow morning, as you're aware, as the National Public Health Emergency Team. We will be continuing to look at, in a sense, the criteria that might apply to any change in the public health advice. Obviously, we're aware that the advice we've given thus far relates to the period up to and including Sunday of this coming weekend, the 12th of April. So we expect fully these measures to be in place all the way up as far as the 12th. We will review at our meeting on Friday, again, the extent to which we think the situation has or merits change. I'm not anticipating that at this moment in time, but we'll keep the disease and the various criteria that we think are important in that ongoing assessment over the week under review. And on the basis that that's the situation, I expect to be pertaining, if you like, in terms of the next weekend. I think our advice will be for people to stay at home. If they have second homes, not to travel to them, not to engage in unnecessary travel or leisure activity of the kind that you might be referring to. We understand the challenge that is for people, the ask that is for society. We understand that it's a significant one, particularly as you rightly say. I heard the weather forecast myself this morning. It's appealing looking weather for the next number of days. That makes it a bit more difficult for people. But we're asking people to have patience with us, to continue to follow the advice, as people have, for the most part, very well followed that advice. And we'll stay in touch with our colleagues on a cross-government basis, including the Gardaí, to have their assessment of levels of compliance, if you like, in the population, to add to our assessment of how we think these measures have been complied with. And that'll inform the decisions that we'll make as we go along. But I anticipate that we will still be asking people to stick with the tough measures that we've asked people to stick with so far.
Tony Richard Chambers from Virgin Media News. Just in terms of the cases among healthcare workers, there's been a very steady increase, over 100 essentially every single day. I mean, is enough being done in terms of support for healthcare workers on the front line? We have heard, of course, concerns about personal protective equipment, but is there anything else that could be done at this point regarding accommodation? Was something that was floated at some point, but what other measures could we do to protect frontline workers?
Yeah, Richard, I might take that if that's okay. I appreciate the pressures that our frontline staff, be they in hospitals or community, are facing, and just to repeat, our collective gratitude as a country and on behalf of the HSE, our huge acknowledgement to our staff who are seeing and treating patients and are also preparing for any surge that might come. So clearly our priority is to protect our staff and also to prevent transmission of the virus within healthcare settings. And you've heard data there showing that a minority of the transmission can be classified as nosocomial, that a majority are community. So in protecting our staff, a key message for us is also bringing in practices within hospitals and community settings which reduce the risk of transmission between staff and patients. And I visited the CUH at the weekend, and I saw they have parallel corridors, separate entrance and exit, and they brought in practices in that hospital to minimise transmission in healthcare settings, showing that their collective and individual responsibility in leading the fight against this virus. In looking at the support for community, it's more challenging for us because we have a number of residential settings we have to address, and Professor Martin Cormacan, who's been supporting all of us in providing advice on infection control and protection, has visited nursing homes, has held a webinar, over 1,200 people logged in for that, and we're providing video advice and on-site training advice on infection protection and control for staff there, as well as trying to direct our precious stocks of PPE to areas that normally we wouldn't be directing them, namely residential care settings and nursing homes. So it's a big challenge for us, a big job for us to support our healthcare staff through advice, through changing practices, and also through provision of PPE. It's a big message and it's a broad message.
Would you say that's the biggest concern at the moment, the number of clusters in nursing homes? It has continued to sharply rise across the week, even since it was cited as a measure needed for the imposition of restrictions. Why is it still rising at the rate that it is?
We're concerned about it, and I've been clear about that since the beginning, and we started to talk about this. When we go back a little and look at the measures we have in place on a cross-society basis, the measures that are in place to social distance, in addition to the personal behaviours that the population has been advised to follow since the very beginning, we think we need to turn our attention to the institutional settings in which we know there is exposure to this virus, where we know there's continuing transmission, and where there are people at risk, both individuals who reside in those locations for whom it's their home, as well as the staff working in those locations. And we think there is an urgency to addressing these measures and working with the nursing home sector. And that's why you've seen some of the measures that have been announced over the course of the weekend, be they financial, be they healthcare, be they infection prevention control, that are directed at the nursing homes. We'll be working with the HSE and with the Health Information and Quality Authority over the course of the coming days to try to do everything we can to slow down the transmission of this virus in those settings, because of our concern for the individuals who are vulnerable living in those settings.
One more from me then, just in terms of the awaited surge. A lot of people within the HSE as well as in frontline doctors say they anticipate, if it's going to happen, it could well happen in the next 7 days or so. How concerned are you about that eventuality? Do you believe that that is the case, that it is likely to be sooner rather than later? And what sort of, what is your feeling on that at this point?
So we've seen progress on a continuing basis now for 10 days or more in terms of the so-called flattening of the curve. We think we're pushing out the wave of infection. We think we're pushing down the peak of that. And the reason that I say that is we started out with a percentage increase day on day of something in the region of 33%, and that has reduced steadily, and that continues to reduce. I said there towards the end of last week that over the course of this week that we're now in, we'd really begin to see whether the measures that we added in, particularly those on last Friday week, the tough restrictions that we've asked the population to work with us on, that we'd see the benefit of those over the course of this week. As we get towards the end of this week, we'll see, if you like, what the full impact of those is, and it'll be much easier at that point for us to start to say we think we will hit a peak at a certain point from now, and to have some sort of assessment of how big that peak might be. But as we continue to improve, we're continuing to grow in our optimism that that peak might be further in the future and smaller.
Hi, Tony. Just to ask you about the figures. A lot of people feel that they can't trust the figures that are being released about the 370 cases today because we've such limited testing. So should we take all of these with a pinch of salt? And when we're looking at, maybe flattening the curve, how do we know if we're not testing?
So we've been clear in terms of our testing policy. We want to test as many people as we can. We know that we're not in a position at the moment to test all of those that we would like, and we've been straight up and honest about that. We share a problem with many other countries in the world in terms of trying to get access to the essential supplies. That has caused us to focus on prioritising testing for people who are ill and in hospital, for example, to also prioritise testing for healthcare workers, and that's what we've obviously been doing. It has an impact on the total numbers, there's no question, but we've seen this trend that I'm speaking about for some time, and since prior to the point at which some of that more recent testing issue, particularly around people have heard this talk about the reagent and the impact that that has on laboratory capacity. Where we're trying to move our focus now to is to try and ensure that we build that laboratory capacity over the next week or two to a point where we will be in a position to, if we were to contemplate lifting the restrictions, and I said this last week, it will be because we have seen the disease start to, if I may say, behave itself in the way we would like, first of all. The numbers of admissions to ICU, the numbers of deaths, obviously, the numbers of cases overall, that these kinds of things are moving in the direction we would like to be moving them in. That's the first thing. And the second thing is that in the event that we were to relax some of those measures, that we know we have the capacity in our testing, sampling centres, that we know we have the capacity in terms of kit that has to be available in the laboratories and our contact tracing arrangements to really be strong and focused on finding cases and, if I may say, aggressively contact tracing those and putting in place strong infection prevention and control arrangements around those cases and their contacts and testing those contacts. And our work over the course of the next 1 to 2 weeks will be to try and get us into that position so that we can really have the greatest opportunity to limit the spread of this infection after a point at which these restrictions that we're living with at the moment are relaxed.
Just a couple of brief ones. What's the backlog of tests? Do we have a number on the backlog? that we're trying to sort through?
What we're going to do, Shane, is give you, and I've given you a number in terms of those that have come back this evening. We'll have Killian, as we do every Tuesday, Killian de Gascoigne for the Virus Reference Laboratory, will give a much more detailed report on testing and plans and numbers tomorrow evening, including positivity rates, including an update on the weekly number of tests that are done. It will see a significant increase in the number that was just over 30,000 last week. Because we have done over the course of the week, we know a significant number of tests. We'll give you that detail in a much more, and we'll have, dare I say, a better person than I to talk to the detail of that with us tomorrow evening.
And what's the average age of the people who've died?
So the average age now is 80.
Well, that's the median age, I understand.
The median. I haven't got a mean to if that's your question.
Yeah. Is there a reason we don't give the average age, that we give a median rather than average?
No, it's like technically speaking, they're all averages. A mean and a median are two different types of averages. So, but we can report that figure. It gives a different impression. It's partly because, as I'm sure you know, if you look at the distributions that you have here behind you, they're both normal distributions. In other words, they're symmetrical. So when you have a mean and a median that are slightly different to each other, it means that the distribution is not symmetrical. There are some much younger people among those deaths. I mean, to be clear about that, there are, as I've said before, there are some people among those deaths that did not have underlying conditions. Lest anybody conclude that every person that we're reporting a death in is over a certain age or had an underlying condition. That isn't the case.
Social distancing just over the weekend, I know people were complaining, as was a question earlier, about those maybe travelling further than the 2 kilometres. There are people worried about the amount that are out jogging. Is there a concern about social distancing when it comes to jogging? And I know there was talk in the UK that there's warning that might ban all exercise. I'm sure you're not going to say you're going to do that, but do you have a concern about social distancing when it comes to jogging? Because there's a lot of it going on around the city.
I've seen quite a bit of it myself, and if I'm honest with you, what I've seen in my own local parks, and I'm not going to say that this is representative of every situation, there are many people out exercising, the weather is good. I have seen that people have kept reasonable distances in the context of that. Our recommendation is clear that you should not be in close contact with anybody who is not a household contact of yours, in other words, somebody within your own family. So you should not be out in groups. And if people are jogging, it seems reasonable that you have to really observe those distances, particularly because, you know, when people are sweating and so on, there's a greater risk of transmission in those kinds of situations. So we're saying, look, if you're out jogging, to do it alone and to not do it with people that you don't share a house with, and to observe the absolute minimum that we're recommending of 2 metres distance.
Right, and just finally from me, is Friday not too late to tell businesses and people that we're going to possibly extend the measures that we have in place up until April the 12th? I think there's probably an acceptance out there that we are going to extend the measures. Is Friday not too late to tell them that?
So look, what we'll do over the course of this week, I'll be as honest and open as I can be with you in terms of what so it's not going to be that we'll reveal everything in one go on Friday. As the week goes on and our impression of where we are is increasing either in one direction or another, I'll kind of share that sense with you, so that wherever we arrive on Friday, formally on Friday, won't be a surprise to you on Friday, if that makes sense. Okay, thanks, Shane.
Tá ceisce beagam gon Dr. Henry dús maidir leis méid dúirt an Dr. Holohan an sin cé an bhfuil a bhfad níos mú ama a gceist sula gur for deire le cuid na sríanta, cé go fada eile is a bheith siad a tastáil.
Ní second fi láthar tá clean de sunrús na figurí tagging go dtíon puinte seo agus de réir dalrih tá méid nach leis an galeg don aidir láí chéile ag níl sé go géir mar ar creidmuid cúpla seachtain hen ach braidí sin ar na figurí tá teach rowing san lénta tá rowing so níl second go fóil ach tá súlagin tá muid dóchas ach fós.
An tarna ceiste tá agam ná an bhfuil aon tuairimí agaí maidir leis an imní a léirigh na cóirlóirí leish inneo faoin gunrú sin atá deanta idir na hospidéal phríomhóideacha agus na hospidéal gnúsáid fríad mar a bheith hospidéal fuiblí iontu. Léirigh siad imní faoin socrú sin inneo agus an dóileat go bheitach na hothair i gcuitine a bheith mhail mar amach fáil go fearlaithan ar na hospidéal phríomhóideacha.
Well, now we're just talking to doing now. My hospital is here, agus sin hospital phríomhóideachas in Ireland. My sheet is an nóí linge sa cogútá roing inis agus so dé mé an haltatá Jan tú tagúir ach táid dógus ach fós go mé na cóirí agus na fearne ilig na hospital príváideach linge I lár na thoíochtta tá roing tá achan cabhrú díchoring dí go géiring a seanach.
Okay. Carmagat.
Hi. Deaths have held fairly steady as regards, the exponential increase in deaths hasn't really happened. That's been the case now for at least a week, I think. So can a surge still come, as it were?
I suppose it depends on what your definition of surge is. I mean,
Well, say where they maybe double or treble overnight. I mean, we'd be surprised to see that now, I think, after seeing the similar numbers for several days in a row.
I understand what you're saying, and I'm not going to say we would be surprised. Obviously, we don't want to see any more deaths. I mean, none of us wants to see that. Our expectation is that we will continue to see deaths. What we're seeing in terms of the pattern there seems, broadly speaking, to be in line with what we're seeing in terms of the infection overall, in terms of the admissions to intensive care units and so on. I guess the question for us will be, how much further is it going to rise, and over what time period? And as I said, our growing sense of that over the course of this week will be informed by what we see arising from the impact of the measures that were implemented on Friday a week ago, 10 days ago now. That over the course of this week we will begin to see the full effect, if you like, of the further restrictive measures that we implemented as a country 10 days ago. And obviously we're hopeful in terms of the pattern of deaths we see in the population. But we still expect to see further deaths. And all I can say to you at this point in time is we'll report in as real-time a way and as honest a way as we can those figures as we have them. And as they give us a greater sense of where we're at in terms of future projections, we'll share that with you. It is worth, just when you're asking me about deaths, pointing out that there are some differences in the way in which deaths are reported in different countries. So what we report in this country is a death in a person where essentially on any part of the death certification by a doctor, COVID-19 is mentioned as a disease, and in which, or where a death occurs rather, and where there is a lab confirmation of that death as SARS, in other words, where we have a positive test in a person who has died. And that will capture more deaths. For example, in France, they're only reporting deaths that occur in hospital settings, and even in England they're reporting deaths in what they call NHS commissioned services. So there are some important differences between countries in deaths and death rates in particular, and important differences in the rates that will also be informed by the level of testing. And although I've been open and we've been honest with you about the testing challenges we've had in this country, we have still done substantially more testing than many other countries. And all of those things give a difference in terms of the rates of deaths that are seen in the population.
I know we've done more testing, but just in the people I know personally who have been tested, I don't know one who has gotten a result back. And the minimum they have been waiting is 14 days. So I had a few questions on that. Do those swabs remain valid? And will these people definitely get their results? Because even for people who would like to return to the workforce, particularly in case of healthcare workers, then can't, because, well, I would imagine most healthcare workers have got the results, but other people need to return to the workforce.
So I can answer that one. The first one, and the Killian de Gascon has been asked this question on a few occasions about the remaining valid, so that's not a concern. But in terms of the important action, it's not the test results, and we've said that before, that we haven't been able to get every test done that we'd like, either as quickly as we would like or as quickly as individuals who've been tested would like it. That's obviously something we would prefer, that things weren't like that. That's why we've emphasised that the important thing for individuals who are tested or who have symptoms and is that they self-isolate for 14 days, and that their household contacts, the people that they live with, restrict their movements. And most of the population now have restricted movements recommended for them. And if people are thinking about workforce, if you had a positive test, the end of your period of self-isolation would be the end of 14 days and the last 5 days of which you would not have a temperature. And so if individuals are well and have a 5-day period at the end of the fortnight where they don't have a temperature, there is no reason for them to be restricted from the workforce. But they should consult their GP in relation to that. If anybody at an individual has a doubt about that fact, their GP will be able to guide them.
Finally, I know that more females have been infected in Ireland. What's the male-female split in deaths?
I missed the question, sorry.
What's the male-female split in Ireland's deaths to date?
In the deaths? I gave you that figure. I'm looking so that I can give it to you precisely. Well, maybe I didn't give you that figure this evening. Just give us a moment and I'll get that figure, because I do have it. I just didn't have it written here. And I don't want to give you an incorrect figure, but there is not, it's not an equal 50-50 split.
If I could just add to your last question, that's okay. The important advice for people who are awaiting tests, as Tony has said, stay at home and isolate, but also their clinical condition is different from the test, if you like. So if they're worried about their clinical condition and they deteriorate, they must contact their GP or medical services, because that's the test will not inform that whether or not what kind of treatment they need or what kind of admission they may need if they have to go to hospital. So it's important for anybody awaiting a test who's in isolation, doing exactly what was required of them, that if they're worried about their medical condition and if any of their symptoms deteriorate, to seek medical assistance and advice, because that's different from the test. Waiting for the test shouldn't get in the way of them seeking help if they feel they're deteriorating. I think it's an important message.
Dr. Glenn is going to give you that piece of information.
So it's 114 males and 60 females to date.
Is that strange that there's so many more males, given more females have been infected in general?
So this pattern is a pattern that's been seen internationally across countries in relation to COVID-19. Generally, about 65 to 70% of the deaths tend to be in males, and that's a pattern that was also seen to a greater or lesser extent with previous coronaviruses like SARS and MERS. There's a number of hypotheses for why that is the case, either biology or behaviour or a mixture of both. So in some countries, significantly greater proportions of males smoke, and the activity of smoking is also associated with touching your face. So again, that's one hypothesis that's been looked at. There's a number of others, but the precise reasons in any one country remain unclear.
Do you have a figure for the amount of people who have been tested to date?
So we give that figure every week on a Tuesday evening, net of Monday. So tomorrow evening we'll have a detailed breakdown in terms of testing. It'll give you a precise number in terms of how many people have been tested so far, how many tested in the previous week since we last gave a figure. The last figure of last Monday evening, I can't remember the precise figure, but it was just slightly over 30,000.
I heard the Minister say at the weekend it was about 35,000. I mean, is that like the round?
So we'll have a figure that'll be a lot bigger than both 30 and 35,000 when we give you that figure tomorrow evening. We'll have the precise figure for you tomorrow evening.
You also mentioned just there, like I heard Paul Reid mention it a few times yesterday at the PPE briefing. You say we're in the top tier of countries worldwide testing. Like, what is that based on?
So, well, it's based on, like, there is information available publicly around the number of tests per million. Do you want to run?
So there's a number of different tracking tools where you can examine the number of tests per million population, and when you examine Ireland's tests per million, we are in the top tier. Obviously that changes day on day and it changes week on week. So when we give the figure tomorrow, then that can go into those reporting tools, and our performance against other countries can be assessed. But what's been very clear over the past period is that the issues we've had around testing notwithstanding, we are still testing very significantly greater numbers proportionately than many other countries are doing. And again, as the doctors have said, that's not to say that we are where we wanted to be or where we want to get, but certainly we plan to increase testing over the coming weeks, and that's a fundamental and a key part of our strategy as we move forward from here.
Could I add to that? It's for all the difficulties we faced, and we have faced difficulties setting up service at a very short time period. It has been a strategy from the very beginning to test in this country, which and that has allowed us to build up these testing centres, to secure swab supplies, to build up the number of labs. And that strategy hasn't been uniform across the world. So despite all our difficulties we had in creating those services in such a short time interval, it's allowed us to put services together to form a foundation for ongoing testing into the coming weeks during another critical time in our battle against this virus.
This is more for Dr. Glenn. Like, you repeat the phrase there, top tier. Like, what do you mean by the top tier? Like, are we talking 10%, 5%?
So we're amongst the leading countries in the world when it comes to testing. So, as I said, it depends on a given day when you put in the total number of tests. So when we give the figure tomorrow evening for the number of tests as of midnight tonight, we'll be able to assess then precisely where we are vis-à-vis other countries in the world. But again, other countries give testing figures at different points in time. So it's not possible at any one point in time to exactly compare one country with another country or a number of countries. So, but what we have seen over weeks is that we are up there with the majority of countries in the world in terms of testing. And again, we'll give the figure tomorrow openly, and people can easily assess that performance vis-à-vis other countries.
Okay, just one last thing. There's been kind of back and forth in the last few days about the use of face masks. I'm just wondering if you could provide guidance on what the latest position is.
The guidance remains the same. The expert advisory group is a subgroup of the NEFIT, and it reviews the evidence as it comes through, not just from journals but from other countries. And our advice remains the same regard to use of face masks in public or in non-COVID related settings, which is that it confers more risk than benefit in terms of the people touching their face more, adjusting the mask, and not realising the limits of the protection the mask gives you in any particular setting.
Thank you.
Thank you. Paul.
Hi. Nursing homes. Obviously, it's an area of concern. Have you managed to work out what the routes of transmission within the nursing homes are and other residential settings? Obviously, you've got staff, you've got residents, and you had visitors. So who's spreading it to whom? Have we any sense of that?
I don't have an absolute breakdown on that. Obviously, it gets in the first instance, not through residents, who for the most part are not going in and out as much as visitors. So it will have gotten in through visitors and or staff. And then the spread in an individual nursing home, if there is to be spread in a nursing home, is perhaps around environmental controls, perhaps around staff across patients. It will depend on the individual circumstance. And it's probably important to point out that I'm not suggesting that you don't appreciate this, but that if we identify an outbreak for a nursing home, it doesn't mean that it's not controlled. An outbreak in a nursing home is essentially a group of linked cases, or a cluster, I should say, a group of linked cases that have been identified in a nursing home environment. It may well be, and this is what we expect in terms of how nursing homes are seeking to manage this and how we're seeking to try and support them, is to do things like cohorting of those and keeping people who have picked up the infection separate from those who haven't, and ensuring that there isn't cross-infection in as much as possible by shared staff and things of that practical nature.
Yeah, and you gave us a cumulative ICU figure, I think. Do you have today's figure?
So yeah, no, you're right. That's not a bang up to the minute figure, if I can put it that way. But that's a breakdown of the first 175 cases, which is the great majority that I've given you there. Where I think we'll be, Paul, is when I said to you that we will have Professor Philip Nolan with us on either Wednesday or Thursday of this week. I think at that point we'll be in a situation where we're giving you as near to real-time breakdown of intensive care and other data, and that will be the continuing figure that we use. We won't be then dealing with the breakdown that's 24 hours old or whatever as we are at the moment.
Right. I think the figures that were out over the week, the numbers in ICU are pretty flat, really.
They haven't grown at the rate that we saw in the early days of this, yes.
And so I'm just wondering, I mean, we have a big problem in residential settings. The numbers are flat on ICU and even sort of, if fatalities are going up, but not, as the previous question said, not exponentially. How fair is it to impose the restrictions on the rest of the population for into the future? I know you can parry the question, but it's a balance to be struck, and it's a huge economic question, as I said before. But we do seem to be getting down to the specifics of where we might know exactly where this virus is everywhere in the community, and there's issues around testing. But we are saying there are clusters here and there, and in particular sectors of society. It's great. But it kind of raises questions about the blanket restrictions applying to everybody and how much they contribute incrementally to our performance.
Yeah, it's a fair question, Paul, and it's one that we grapple with on an ongoing basis. And I don't want to premise anything I say by assuming that, we think that we have reached a point where we're able to kind of take definitive conclusions and start to make projections on the basis of some of the things that you've identified there. They will all play into our ongoing assessment. If we have seen an impact, as we have seen in the course of recent weeks, that is pushed out or suppressed or flattened or whatever words we wish to use, either the number of cases or ICU admissions or indeed the number of deaths, it will be because of the societal measures that we have in place, primarily because the infections, as we were identifying them, in large part, percentage-wise, were occurring through so-called community transmission. People were picking up this virus in the course of ordinary social interaction. We couldn't tell where they were picking it up. They couldn't tell where they were picking it up. And that meant that people were encountering this out in the population, and it was out and among us in the community. And we feel that these measures were necessary to try to interrupt those so-called chains of transmission. We don't think we're all the way through that, because this epidemic is still in this country growing at an unsustainable rate. If we don't sustain these measures and see further suppression, we will have a challenge in terms of our, first and foremost and most importantly, the impact on the health of the people who pick up this infection, but secondly, in terms of our capacity as a healthcare system to deal with that. So we have to continue to work at these measures. What we want to do is to then ensure that we don't end up in a situation whereby these measures are imposed longer than is necessary for the control of the infection. That's where we want to move on quickly to deal with these institutional settings, because as we move hopefully into a situation that the risk of picking this up in the wider community is lower, we don't want to have a situation whereby there are settings within the population, in institutions for example, whereby in addition to the risk for the people living in those institutions might act as a potential source of reinfection for the community generally. That's something we see with flu in the wintertime, that often with schools, nursing homes, hospitals, these are sources of infection often that can add to the experience of the population in terms of influenza. And so that's why we have to continue to focus on dealing with nursing homes, primarily for the health and well-being of the residents, for the staff, and then also as a potential source of reinfection, if you like, of the population as we go along.
Okay, and just finally, I wasn't at the Taoiseach's briefing today, but it was reported that he was asked about childcare for health workers, and he said it needed a public health input, and he was waiting for that before a decision could be made.
And we're giving further consideration to that issue tomorrow at the National Public Health Emergency Team. Yeah. Thanks, Paul. Thanks, everybody.